So today, welcome back. And for those of you who may be joining for the first time, welcome. As you know, the Flash Talk is a brief 10 to 15-minute presentation on an infection prevention topic. And the topic today, of course, is getting back to basics in infection prevention and control. So let's go to the next slide. Thank you. Okay, so we're going to talk about, for the last 3 years, we've been focused on COVID. Everybody is pretty sick of COVID. And it's diverted our attention away from other infections. Now, if we were talking to you and you lived in Nevada, we would probably be talking about CRS because it's a huge problem in southern Nevada right now. But we're not going to talk about CRS today. We're going to talk about norovirus. And we're talking about norovirus because it's so infectious. And it's you really have to be very aggressive to get it under control in a congregate living setting. Or, well, we'll talk about the roundtable when we get to that, and you'll see where else you can have problems with norovirus. And it's important to focus on all infections, not just COVID, in long-term care and in home health. So let's go to the next slide. Home health and hospice, I should say. Okay, so why are we so concerned about infections in long-term care settings? Well, we know that you have residents who live in close proximity to one another, more than if they lived at home by themselves or with a small nuclear family. So they're exposed to more organisms that are coming into the building, and to other residents who are coming and going throughout the day and coming and going, being transferred in and transferred out. We know that there's staff turnover. You have unlicensed individuals who often are inexperienced or just don't understand infection prevention basics. And then people who live at home, for the home health individuals or residential care facilities, there are home health staff who may be coming in, other staff who may be coming in, other people coming in providing services, maybe the durable medical equipment people coming in with oxygen or Meals on Wheels delivering food. And then the home health staff coming in, maybe CNAs, nurses, physical therapists, a variety of people who come in and can expose the individuals to illness. And that's not to say it's only healthcare people, but it can be children, grandchildren, any number of people, friends who are coming into the home who can expose the individual to illness. And then we know that residents or patients who have weakened immune systems are at greatest risk due to advanced age or if they have comorbidities. Let's go to the next slide. Oh, so what are the most common infections in long-term care? Well, you guys could probably fill this out for me, but we know SARS-CoV-2 because it's been top of our minds for the last 3 years. We know urinary tract infections are often misdiagnosed. Just because you do a urine dip and somebody has leukocytes does not mean that they have a urinary tract infection, because the definition is they have to have more than 50,000 colonies of bacteria in their urine. So you can't diagnose a UTI with a urine dip. You have to send the sample to the lab to definitively diagnose it. Then we also know that especially going into this colder season of the year, we'll see more pneumonias and influenza. We're anticipating a big flu year this year. Often people who get the flu go on to develop pneumonia. So be aware of that. It's important to get everyone vaccinated. And then we see skin and soft tissue infections. You might see cellulitis. You may also see scabies. Scabies is, I could have talked about scabies today, but I think norovirus is a bigger challenge, actually. So gastrointestinal infections such as norovirus, bacteremia infections, bloodborne viral illness, and conjunctivitis. Conjunctivitis is not uncommon, and often if somebody is not doing proper hand hygiene after going to the bathroom and then rubs their eyes, they can give themselves a conjunctivitis, or if their nails are not kept short and clean. So those are things to be aware of, but let's go to the next slide. Let's talk about what we know about norovirus, other than the fact it is a nasty, nasty thing. And if you happen to get it, it makes you feel miserable. We know it's very contagious. It used to be called, of course, I'm now drawing a blank. It was, well, anyway, it's called norovirus now. So we'll move on and it'll come to me. It's very contagious. You can catch it by having direct contact with an infected person, consuming contaminated food or water. And the food that we think about most commonly is uncooked oysters. So don't eat those raw oysters. Touching Norwalk virus. Thank you, Cynthia. I remembered it yesterday. I forgot it today. It used to be called Norwalk virus, but now it's norovirus. Touching contaminated surfaces and then putting your unwashed hands in your mouth or on your face or mucous membranes. And the onset of the symptoms can be as quick as 12 hours after exposure, but generally 24 to 48 hours after exposure, you can come down with the symptoms. Let's go to the next slide. And to protect yourself from norovirus, you need to wash your hands often, rinse fruits and vegetables, cook your shellfish thoroughly. Make sure you cook those oysters. And if you're sick, stay home for at least 2 days after the symptoms stop. And you say, well, what are the symptoms? Nausea, vomiting, diarrhea. So you want to stay home 2 days after the diarrhea stops, because then you won't be contagious. And then continue to wash your hands diligently. And then avoid preparing food for others when you are sick and for 2 days after your symptoms stop, because you could still be shedding the virus. Let's go to the next slide.